We had also a very nice session yesterday about disparities in prostate cancer care, and I mean, it was very interesting because I'm a prostate cancer person, and when I started looking for literature, I found out that the disparity actually already starts with the disease, because there's much more literature about disparities in breast cancer management than in prostate cancer management. So that was actually interesting to see. And then if you look really worldwide, there is a wide variation in the incidence of prostate cancer, and that is also sometimes influenced by PSA screening, if that's recommended or not in a country. But perhaps more importantly, there is a huge difference in mortality rates in different countries, and that always means if you have big differences in mortality rates, that something is wrong. And I think there's different reasons for these differences. So there's genetic reasons that could be there, that it's very probable. There's environmental reasons that are likely involved. But one of the biggest things really important is the socioeconomic factors. And that starts very fundamentally with having access to treatments. So there's still nowadays, there's countries in this world that don't have access to radiotherapy, and radiotherapy is an essential part of our treatments. And sometimes the machines are there. Like I just had a friend of mine who sometimes does voluntary work in Western Africa, and so the machines are there, but there's no educated personnel to give the treatments. So there's different layers of problems there. And also obviously access to cancer drug is very, very different from country to country. And the WHO has done a list of essential medicines, and there's even countries in this world where you can't even have access to these essential drugs that are normally very cheap for us, from the Western world. So I think there's big disparities there, and we also think that this is probably even gonna grow, because we know that in low and middle income countries, the rates of new cancer cases is estimated to grow much faster than in the countries with high income. So different reasons. Actually, we are a bit like the victims of our success, because we have reduced infections, we have reduced poverty. So now, that's a good thing, that people survive longer, but that also means that they get cancers, because cancer is more a disease of elderly people. And also with the increased westernization of these countries, there is more cancers now coming that are typical for Western world, like prostate cancer. So I think there's a lot ongoing, and we have to be aware that there's going to be these disparities that's probably even going to grow. And then, like we had the example that the disparities are not only between countries, what is pretty clear, but also in one country. And there is a very good example from Switzerland, very rich country where I come from, where everyone has health insurance, but there is the risk of a man from a low economic class to die from prostate cancer is twice as high as from a man in a high socioeconomic class. So there is, even in rich countries, there are differences, right? And that starts with missing information about prevention and early detection. People go later to diagnosis if they have the initial symptoms. In this group there's more comorbidities, what adds complexity to the treatment, obviously. And also probably the access to specialists is better if you're in a higher socioeconomic status. There's a lot of reasons, but it's actually very interesting that even in rich countries that can happen. And especially then we focused on the situation in the US, and it is really, really interesting to see that there are differences in mortality rates in Black people. And it seems there was just a very big study 2 days ago in JAMA Oncology that most of these differences are probably non-biological. They are really by access to treatment, access to information. And I think this is actually a very sad story that we have these differences, because of really missing access, not because of a biology. And that was also shown in one of the plenary sessions, right? So where they showed that if you have more healthcare, these disparities vanish between black and white people. So I think there's a lot to do for us, and there was also one interesting talk about financial toxicity, that in the US a lot of people have to pay out-of-pocket costs, and they go into bankruptcy, and they have really all this stress, so you have already cancer, and then you know that about 20% of your salary is going to go to your out-of-pocket costs for medicines. So it's like, it was really amazing data that just showed that this adds so much stress to people who have already cancer, and that obviously also has an influence on outcome. So in the end, in the summary, it's like really there are a lot of disparities, and we have to find a way how we can try to change that.